there's that moment of realization that what you're experiencing is not a temporary disruption, that things aren't going to be the same. I would stay up all night combing through the medical literature to understand what this meant for our patients, for our families, for our own health.
So on a dime, we closed down our operating rooms, except for emergencies, and we actually moved those resources to the clinical care environment on a floor in an intensive care unit to support operations, and just started to staff upwards, waiting for those patients to come.
We are on top of this, and we are ready for what may come our way.
We realized very quickly this was not a sprint. This was not a crisis that happens over a period of a few days. We were in it for the long haul, for the marathon.
One of the things that became really clear early on was that without a test to actually tell us that we had COVID-19 patient in the hospital, we were essentially flying blind.
We were actually one of the first hospitals in the city to have our own homegrown CDC-adapted lab test.
I remember being in my office and getting the call from the lab tech to say we have a positive COVID patient. I can still see myself running down the hall to go look at this result.
Joey's here, firefighters running toward the fire, and nurses run towards pandemics. The fear goes away once you're gowned and you cross the threshold. The fear is left outside.
Nurses, our environmental services staff, our supply chain staff, our security personnel. These are the unsung heroes.
The regional care network, instead of being an alternative, it became the primary way of taking care of so many of our patients.
It was a big change for us because the technology that we had was not scalable. And we had to make sure that we have the right technology very quickly to enable those televisits to take place.
We will look back and think we came out of this a stronger organization.
People who came together went beyond what a crisis needed them to do. The sacrifices that my colleagues made during that time, it really speaks highly of the commitment that the healthcare workers made, and I saw it firsthand.